Hello everyone, and thank you for joining us from the Harrison Township Public Library. My name is Mary, and we're here today with Bev Clark from the Michigan Medicare Medicaid Assistance Program, and she will be presenting a program on Medicare Basics. So I'll hand it over to you. Thank you, Bev.
Thank you so much, Mary, for inviting me to the library today. I am Bev Clark. I am the coordinator of the Medicare Medicaid Assistance Program here in Macomb County. That program lives at the Area Agency on Aging 1B, which provides services to seniors through the 6-county area in Metro Detroit. So today we're going to talk about Medicare Basics. And when we talk about the basics, the first question is, what is Medicare? Well, Medicare is the nation's largest health insurance program. It currently covers about 60 million Americans. The program was signed into law by President Lyndon Johnson, and it became effective in July of 1966. Currently, Medicare is health insurance for 3 groups of people. People in the country who are age 65 and older, people who are under 65 with certain disabilities. That would be people who are entitled to either Social Security disability or railroad disability benefits for at least 24 months. And the 3rd group of people are people of any age who have end-stage renal disease, which is permanent kidney failure requiring dialysis. Medicare is administered by the Centers for Medicare and Medicaid Services of the federal government, and enrollment happens through the Social Security Administration for most folks. And if you were a railroad worker, you enroll in Medicare through the Railroad Retirement Board. It's very important to remember that Medicare is health insurance for individuals. If you are married, you and your spouse need to enroll separately and make separate choices about your Medicare coverage. So when do you enroll in Medicare? Well, the initial enrollment period for Medicare spans the 7 months surrounding your 65th birthday. That's the 3 months prior to you turning 65, the month you turn 65, and the 3 months following your 65th birthday. Social Security advises people to apply for Medicare benefits 3 months before age 65. You do not have to be retired to get Medicare. And no matter when you're eligible to receive your Social Security benefits, you are still eligible for Medicare at age 65. So you sign up during the first 3 months of your initial enrollment period to get your coverage effective the month you turn 65. If your birthday happens to be the first day of the month, your coverage will start the first day of the prior month before you turn 65. And if you wait to sign up till the last 4 months of the initial enrollment period, the month you turn 65 or the 3 months after, your coverage start date will be delayed. There are certain people who are automatically enrolled in Medicare. If you are already receiving Social Security benefits, you will be automatically enrolled in Medicare Part A and Part B without an additional application being necessary. You will receive an initial enrollment period package, which includes your Medicare card and other information, about 3 months before you turn age 65. And coverage will begin the first day of the month that you turn 65. If you are receiving Social Security benefits and it's like 2 months before you turn 65 and you haven't received a packet, you'll want to contact the Social Security Administration. There are 4 parts of Medicare. Part A is hospital insurance. Part B is medical insurance, or insurance to see the doctor. Part C is Medicare Advantage. Those are plans that are designed like HMOs and PPOs. And Part D is Medicare prescription drug coverage. And we're going to go through those parts in the rest of this presentation. First off, original Medicare. Medicare Part A is hospital insurance. That helps to pay for medically necessary services when you are admitted to a hospital. The areas covered under Part A include hospital inpatient care. Now, this is for a semi-private room, meals, general nursing, and other hospital services and supplies. It also covers care in a skilled nursing facility, not long-term care, but care that you are admitted to a skilled nursing facility for perhaps rehab following a hospital stay. Part A also covers home health care. Now, this is care that a doctor has prescribed for you because you are what Medicare considers homebound, which means that leaving home is a major effort. You will need a doctor's prescription for the care. It does need to be provided by a Medicare certified home health agency, and you pay nothing for the services at home. In addition, Part A covers hospice care. This is for people with a terminal illness that's been certified by a doctor. It does cover drugs for pain relief, symptom management, medical nursing, and social services regarding hospice care. And it also covers other services that Medicare doesn't usually cover, such as grief counseling. Okay, Medicare Part B, medical insurance covers a number of medically necessary services and supplies. Areas covered include doctor's visits and services that you receive when you visit the doctor, outpatient medical and surgical services and supplies. For approved procedures like x-rays, a cast, or stitches, you would pay the doctor 20% of the Medicare approved amount for the doctor's services. If you have these services outpatient in a hospital, you also pay a copay to the hospital for those services. Clinical lab tests are covered under Part B. Durable medical equipment, such as wheelchairs and walkers, are covered under Part B. And also preventive services like exams, lab tests, screening, and shots that help prevent, discover, or manage a medical problem. Original Medicare costs. Original Medicare is not free. While the cost of many Medicare approved services are covered completely, there are costs associated with both Part A and B. Now, you do not pay a premium for Part A coverage if you have worked and paid Medicare taxes for at least 40 quarters. That's 10 years. If you worked less than 40 quarters, the amount of the premium is scaled upward based on the number of quarters you did work and pay taxes. The fewer quarters that you paid Medicare taxes, the higher premium you would pay. But if you have that 10 years of working and paying taxes, there is no premium for Part A. There are, however, deductibles and co-insurances for inpatient hospital stays and mental health facility stays. And there is also a copay or a co-insurance for 21 or more days in a skilled nursing facility. Part B, the medical insurance. Everyone with original Medicare pays the Part B monthly premium and an annual deductible. This premium has remained below $150 for a number of years, and the annual deductible is minimal compared to standard health insurance. However, under Part B original Medicare, you are responsible for 20% of most services provided by Part B, with the exception of lab tests and services that are Medicare approved, including preventive care and an annual wellness exam that Medicare does cover in full. Okay, let's talk a little bit about Part C, which are Medicare Advantage plans. Medicare Advantage plans are a type of Medicare health plan that's offered by private companies that contract with Medicare to provide all your Part A and Part B benefits. Most Medicare Advantage plans also offer prescription drug coverage, and many of them offer additional benefits like a health club membership or payment for over-the-counter medications. If you're enrolled in a Medicare Advantage plan, most of your Medicare services are covered through this plan. If you join a Medicare Advantage plan, though, you may have to use in-network doctors and services, because they are structured as like HMOs and PPOs work, which we're familiar with. So with a Medicare Advantage plan, you will still pay your Medicare Part B premium, plus you pay an Advantage plan premium, which is usually very low. And you will have small copays for doctor visits and other services, but those are less than you would pay with just original Medicare. So Part C is another way to get Medicare coverage and lessen some of those 20% copays that you're paying with original Medicare. Now, what is Medigap? Medigap, or Medicare Supplement Insurance, is another way to help pay for some of those 20% copays that you pay with original Medicare. It's a group of private health insurance plans that supplement or help fill the gaps in original Medicare, like deductibles, coinsurance, and copayments. Medigap plans do not have networks. They pay for Medicare-covered services provided by any doctor, hospital, or provider that accepts Medicare. Medigap may cover certain things that Medicare doesn't, depending on the Medigap plan. However, Medigap plans do not normally include prescription drug coverage. Now, we refer to standardized plans, or all plans of the same letter have the same coverage. Medigap policies sold by insurance companies must be one of the standardized plans that are approved by Medicare. Each of these plans are named by letter, has a specific set of benefits no matter which insurance company sells it, so they can be easily compared. And it's very important to compare Medigap policies because each company decides which Medigap policy it will sell and the price for each plan. Again, this is all done with Medicare review and approval. Now, a Medigap policy only coordinates with original Medicare Parts A and B. You cannot purchase a Medigap plan to cover the unpaid parts of that Medicare Advantage HMO or PPO plan. And they also do not work with Medicaid, low-income coverage. And even though persons with disabilities may be covered by Medicare, not all Medigap plans are offered to persons under age 65 who have this Medicare coverage. When do you buy a Medicare Advantage or a Medigap plan? Medicare Advantage plans can be purchased at the time that you enroll in original Medicare Parts A and B, or during any fall open enrollment period, which is October 15th through December 7th every year. You can also change Medicare Advantage plans each year during a Medicare Advantage open enrollment, which is January through March each year. That's when you can go back and forth between one Medicare Advantage plan to another. You are guaranteed the right to purchase a Medigap plan without medical underwriting during the first 6 months after you enroll in Medicare Part B. The guarantee means that any company that sells Medigap plans must sell you a plan, and they are prohibited from medical underwriting, which is considering pre-existing conditions, in their pricing. You can purchase a Medigap plan at any later time as well, but companies may then consider pre-existing conditions, and they also do not have to sell you a policy at all. Part D is Medicare prescription drug coverage. This coverage is provided through standalone Medicare prescription drug plans, which is something that you would purchase if you bought a Medigap plan, because Medigap plans do not include prescription drug coverage. Part D is also offered through Medicare Advantage plans and other Medicare plans. Now, Part D plans are required to equally cover a minimum range of drugs in each drug category. There are many, many different plan choices and many different coverage levels above the minimum required by Medicare. There are generally very low copays on the most common prescription drugs. And you can review your Part D plan every year during that fall Medicare open enrollment period And you can change your plan at that time every year if you want to accommodate any changes in your prescription drug needs. Now, even if you take few or no prescription drugs, you should choose a Part D prescription drug plan when you enroll in Original Medicare. There are Part D plans that are available at very low costs. And if you have one of these, you'll be covered even if you need just a short-term prescription like an antibiotic. But of longer-term importance, if you do not enroll in a Part D plan within 63 days of being beginning Medicare coverage, or if you go without Part D for more than 2 months at any time, you will begin to accrue penalties that will result in higher premiums when you do enroll in a Part D plan later. So what help is there available for people with limited income and resources? There are programs that help folks with limited income and resources pay for their Medicare costs. Extra Help is available to help pay for Part D prescription drug costs. This can be applied for through the Social Security Administration. It is referred to as Extra Help, also known as LIS, which is the Low Income Subsidy, to help subsidize costs for Part D. Medicare savings programs offer help through the state's Medicaid program. They can help pay Medicare premiums, deductibles, and coinsurances. You apply for these programs through the Michigan Department of Health and Human Services or through their website, which is michigan.gov/MIBridges. Also in Macomb County, My Health Link plans are available for persons who are fully dual eligible for Medicare and low-income Medicaid. Information can be obtained through DHHS or by calling Michigan Enrolls at 800-975-7630. Now, this has been a brief overview of Medicare coverage and the various options available through the Medicare program. So now you have the basics, but there are many details that this brief presentation did not cover. Resources that you can access for all the details on Medicare and its elements include Medicare.gov. That is the official government Medicare website. You will receive a Medicare and You handbook each fall when you already have Medicare coverage. It includes details on coverage and any changes from the previous year. But you can also go to the Medicare.gov website and order yourself a copy of the Medicare and You handbook. And you can call 1-800-MEDICARE with specific questions about Medicare coverage. Now, your best source of information in Michigan is our Medicare Medicaid Assistance Program. We don't sell insurance, and we are not connected to any insurance companies. What we do in the community is we offer educational programs such as this one. Plus, we offer free, unbiased individual counseling to answer your Medicare questions and help you understand the coverage that's available to you. We can be reached year-round to answer questions, and we can offer you specific help if you're new to Medicare or if you want to compare plans during the annual open enrollment periods. You would call 800-803-7174 to make an appointment with one of our state certified counselors. So please feel free to give us a call, and I'd like to thank you for your attention to our Medicare Basics program today.